Today's video is going to be about my first semester at nursing school. So just a little bit of background before I start. If you haven't seen my video that I posted, I think it's probably about 9 months ago now, I just kind of talked about the whole process of applying to nursing school and being on the wait list, and then getting accepted and taking the prereqs and all that stuff. So there's a more detailed kind of description on all of that and everything that happened on there if you want to watch that, but just kind of the quick and dirty now. Basically, I'm in a Bachelor of Science nursing program. It's an accelerated program, so it's 23 months long, just a month shy of 2 years, and I'm assuming it's because we have this month of August off now, and that's why it's 23 months. So in our first semester, it went from January 2017 until April. So in that time, we did fundamentals of nursing, and that comprised of, it was an accelerated course, so it was like 101 and 102 combined together. We had labs where we learned the basics, vitals, blood pressure, temperature, pulses, all that stuff, bed baths, bed making, all the basic things. So we learned that in our labs, and then we had a clinical rotation in long-term care. If you guys want to see a video on my whole long-term care experience, let me know. It was a great experience. We really were able to hone in on those nursing skills with bed baths and transferring patients from bed to chair, or from chair to a commode and things like that. So we really started getting those basic things down in that rotation, and it was a great experience. And I think that everybody should kind of start off that way in nursing school. And I don't know if every program is structured like that, but it's nice to see. It's nice to see what healthy older adults are like in long-term care settings. Because I know our professor said this going into the program, that you think of the elderly population, and a lot of the time the first thing that comes to your mind is just sick older people in a hospital bed, just basically waiting to die. And that's not what long-term care is at all. Some of these residents are, they would just shock you. The things that they can still do, up walking, they have exercise classes, they have music classes, it's incredible. And how, a lot of them still have their independence. Some of them do have a little less independence and require more care. But it's really great to see, healthy older adults in that kind of setting before going to like an acute care setting where you see a lot of, elderly people with chronic conditions and comorbidities and things like that. So it was a great experience. Let me know if you guys want to see a video on that, and I'll definitely do that for you. So in addition to fundamentals and that lab and clinical, we did pharmacology, pathophysiology, and health assessment. So health assessment was a really great course. We learned all our basic assessment skills in that time frame that we did that. There was a lab component. We basically were partnered off with our classmates every week, and we went through all the different body systems and how to assess each system and the different, all the important things and what questions to ask, and how to dig deeper into, assessing a patient. So we did that. The lab exam, the final exam in that course, like some people call it the OSCE or skills exam, was nerve-wracking. At our school, they have like overhead cameras, and they have microphones and this whole setup, and they record you, and it's a lot to handle. But we all got through it. It wasn't as bad. It was one of our first ones, so it wasn't as bad as we thought it was once it was over. So that takes us to pharmacology and pathophysiology. So a lot of people I've heard struggle with pharmacology. I really enjoyed the course. It was probably one of my favorites to date, and I don't know if it was just because of the professor that we had or what it was, but she was amazing. She's a nurse practitioner, so she has lots of experience. She was always, able to give stories and things like that. So that was a really great experience. I did very well in the course. So if you guys let me know in the comments below, I know a lot of people struggle with it. If you want some tips or advice on how to kind of, navigate through pharmacology, let me know. Hopefully I can offer you some advice. So then we had pathophysiology as well. Patho was another great course, great professor, really knows what she's talking about. We went through all the different systems and all the disease processes, and it was just super course, very informative, very interesting, and I loved it. So that takes us to the end of April, and then from April to June, I think, yeah, April to June, we did kind of like a pediatrics unit course, and we had clinical as well with that. So we learned about all things, children, how to assess children, the differences in their, body systems between a child and like an adult that we've already learned, how to assess that, the differences, the changes, everything like that. So we did that, and we did a clinical rotation on a pediatric, acute care pediatrics unit at the hospital. That was very interesting. Learned a lot there, saw some things, had some experiences that, it's basically life-changing. When you see, like my first, quick story, my first patient that I had was a very young girl who has cancer. So, like, just an incredible little girl, and an amazing experience being able to, take care of her, and just be able to talk with her and talk with her mother, and just, it was amazing. The whole thing was great. So if you want to see a video on that, let me know. I'll make one of those as well. We also did a school health rotation, so we went into an elementary school and for a few weeks and did kind of observation and assessments on children and developmental stages and where they're at. And we also did like a teddy bear clinic. So the kids brought in their teddy bears, and we kind of, performed nursing things like immunizations and things, and, wrapped their arms and their ears and everything like that on these bears, just to kind of get these kids used to hospital environments, so that maybe when they go to have an immunization or go in to have a checkup or whatever, they're not as scared going in because they've kind of been exposed to it already. So we did that. We also did like health teaching presentations to these kids. It was a great experience as well. So then moving on, that was the end of that. And then from June to the end of July, we did our first med-surg course. So everything med-surg related, we did that. It was great. A lot of information, but it was, very informative, and I found it very interesting. So we did a clinical rotation during that time as well on an acute med-surg floor, and that's the first time that I really felt that I was, nursing and able to, do all these nursing things. During this time, we learned a bunch of other skills. So we did injections, all the different, types, sub-Q, IM, intradermal. We did butterflies, like sub-Q butterflies, putting them in, all that stuff. We learned how to put Foleys in and straight caths, and learned how to take care of chest tubes and all that stuff. Dressing changes, complex dressing changes, packing wounds, things like that. So that we got to use a lot of those skills in clinical, and it was great to be able to, hit the ground running with those and just, start feeling like you were actually, a nurse. So med-surg nursing, it was a lot of fun. It was definitely challenging. There was a lot of, first experiences. I actually got to see my first surgery. It was a total hip replacement, and I met the patient before, went into surgery with her, and then coming out, I had her as a patient for the next 2 days. So that was a really great experience, being able to follow a patient, before surgery, during the actual surgery, seeing the procedure happen, which was amazing, so cool to see. And then, following after and doing all the post-op assessments and the dressing changes and everything like that. Pain control and administering medications and everything like that. It was a great experience. So that's basically been just like kind of a quick glance of how my first 7 months went. Technically, if you are to relate it to the 4-year Bachelor of Science in nursing programs that are here in Canada, I don't know kind of how it's structured in the States, but it's mostly 4-year programs. So technically we did 2 years of nursing school in 7 months. So right now, when I go back in September, I will be considered an SN3, which is like a student nurse 3, so like a third-year student on the 4-year scale, if you will. So it's pretty crazy, fast, furious, but I absolutely love it, and I can't see myself now that I'm in it. I don't know how I didn't, get into this sooner. I don't know how I didn't realize that this is what I was meant to do, but I absolutely love it. I'm enjoying it so much. It's so great to be able to help people, and just get those little simple thank yous, and they're so patients. Some of them are appreciative and, love having you there and love, having you learn with them. So it's been a great experience so far, and I'm excited to have a break because we have been working really hard, me and my, 15 classmates. So we've been working really hard. It's great to have some time off. It's the summer, it's August, it's beautiful. So I've been spending a lot of days on the beach and just hanging out with friends and everything like that. So I'm excited, to be on break, but I'm also excited to go back to school and continue on. So if you guys have any suggestions for videos that you want to see, just let me know in the comments below. Also follow me on Twitter and Instagram at LiveNowNursing. And you can check out my website for everything nursing related. You can get these videos on here, additional blog posts. I'm also going to do a download section to kind of give you some things that I've used in nursing school to help me stay organized and just get things done. So guys, thanks for watching. Leave some comments below. Let me know what year you're in. If you're thinking about going to nursing school or if you're already finished, how was it? Let me know. Any tips for third semester? I think in September, we start with psych, mental health. We're doing, I think, another med-surg rotation, and we're doing nursing research and leadership as well. So yeah, that's where we're at right now. And I look forward to, communicating with you guys. Leave me a comment, talk to me on Twitter, on Instagram, send me messages on here. I'd love to chat and see where you're all at. So thanks for watching. I hope you guys have a great day. And I'll see you soon.